It's really an emotional story because this man wanted to live. He wanted to walk out of that rehab, but that day never came. They spent a lifetime together. Catherine and Ed Unich married 58 years. After entering rehab, Ed went downhill fast. His wife and daughter Jennifer watched his decline through the glass.
The one day that we were there looking in the window, when he tried to get out of bed and fell in the corner, his face was bright red.
April 11th was a bad day.
And we said at the time, I wonder if he has a fever. And we were told, oh no, he is fine.
And they rushed in and they immediately put down the shades, and that was the last time that we got to see him.
About 72 hours later, he would be dead, and he wouldn't be the only one. Riviera Palms became one of the Bay Area's most dangerous nursing homes during this pandemic, with a high number of cases and fatalities. Did they call and tell you that he had tested positive for COVID-19?
No.
The rehab facility would not talk to us.
We just kind of want some answers as to what happened while he was there.
8 on Your Side has been fighting for the right of families to know what's happening inside nursing homes. Tonight, we called Southern Healthcare Management in charge of this facility and 2 others, also the site of deadly outbreaks in the Bay Area. They say that they were never told that he got a test for COVID-19. They were never told that he tested positive. We're trying to see if you can contact them and give them some information. In a statement, the management company says they, quote, pray the family will be able to find peace. Tonight, they're calling Ed's relatives to detail his final moments. Tonight, with nursing home cases surging, Florida is still refusing to name the facilities with infections. 8 on Your Side discovered this nursing home has nearly 30 coronavirus cases.
This governor needs to step up to the plate. He's blocking the release of information as to what facilities have the coronavirus in it and how many patients.
From Pinellas to Polk County, we're hearing from Floridians worried sick about loved ones in long-term care.
It bothers me that they're not being 100% transparent with us.
Cases are skyrocketing at long-term facilities. In Pinellas, 62 cases. Manatee, 46. Polk and Sarasota each seeing 25 cases. And here's the latest numbers for other counties as of Thursday morning.
I think it's outrageous that the nursing homes will not voluntarily disclose that information.
While we have the numbers, we don't have the names of nursing homes with positive cases. Florida Senator Gary Farmer is one of the lawmakers now pushing the state and nursing homes to be more transparent.
So they're hiding behind those laws and not disclosing in real time their coronavirus situations.
Is there anything that you can do to help us get this information and pass it on to our viewers?
We've been working with the governor's office. They have, worked with us on a number of different issues, and I'm hopeful that they will rethink their position on this issue.
Florida is finally naming the facilities with infections, but that is all they're doing. They're not releasing any more information, and families say that is not enough. 8 on Your Side has worked around the clock to get details about nursing homes with infections. We filed public information requests, pointed out how other states were releasing this data, and we kept telling your stories.
There are almost 600 people that live here. We have a right to know.
They're not being 100% transparent with us.
This governor needs to step up to the plate.
A few people taken to the hospital last week came back positive. And they're not really telling the employees.
The Florida Department of Health claimed any disclosure would violate privacy laws until this weekend, when Governor Ron DeSantis suddenly changed direction.
My view is look, if this is going to potentially expose like a patient record, but I don't think it will. We're just looking at it, and I think there's other states that are moving in this direction too.
Here's the list families have been waiting for. Florida is now naming individual nursing homes and facilities with infections, but the name is all you're going to get.
It's a nice attempt, kind of almost a half-hearted wink and a nod to full transparency.
Brian Lee's nonprofit advocates for nursing home residents. He says the state is still protecting the industry over families.
Because we don't know if these are facilities that have one positive or 100 positives. There is no insight into the severity of the outbreak according to this list.
Tonight, 8 on Your Side continues to push the state to reveal critical information, including the number of cases at each facility, a breakdown of resident and staff members, and the number of deaths. So the Department of Health is responding to us tonight. They say they always notify people about possible exposure. And Stacey, they say that giving us any more information, again, would violate privacy laws. The nursing home says that before this outbreak happened, they turned to the state for help and they did not get it. It's a sight we've seen twice in a matter of days. Elderly residents being evacuated after a coronavirus outbreak. It's happened in not one, but 2 nursing homes in Pinellas County. At Freedom Square, it turned deadly. At St. Mark Village, so far tonight, 13 residents and 8 employees have tested positive, but that number could grow. The facility says upwards of 100 more tests were conducted today.
Once the virus gets into a home, it spreads rapidly throughout the nursing home.
All the experts agree coronavirus can wreak havoc at nursing homes. 8 on Your Side wanted to know if these facilities are prepared. Do they have the personal protective equipment they need?
Well, all of us have had problems getting the PPE equipment. There's just no system to do it.
Doug Fresh is the CEO of St. Mark Village. He says to prepare for the outbreak, he turned to the state for help, but nothing came of it. It's a complaint 8 on Your Side has heard from others as well.
Staffing has been somewhat of a challenge. We've got a lot of people that have put in a lot of extra hours. So we've asked for both of those, and pretty much in those areas, the state was not that helpful.
Tonight, the state responding. They say this week there's been another major push to get PPE to long-term care facilities, including 4 million masks, 200,000 face shields, and 500,000 gloves. So the state says they are sending more supplies and more help to these facilities. We have requested a county-by-county breakdown. We know they're sending help to the areas that need it the most first.
We want to stress this. According to the state's own data, their own information, this list is wrong.
Tonight, the evidence that Florida's master list of nursing homes with infections is flawed. For several days now, the state's website has reported 2 coronavirus cases at facilities in Hernando County. So a Hernando County facility should be on the master list. But look for yourself. You can see it is not. 8 on Your Side has been pressing the state to include critical information on the list. We've put in a request for the number of cases at each facility, a breakdown of resident and staff members, and the number of deaths.
We got to fix the list.
Luke Newman is with Palm Garden, a company that operates nursing homes across Florida. He points out another problem. He says 3 facilities on the list in Clearwater, Largo, and Winter Haven are currently 100% COVID-free. Newman doesn't think having 1 case at one time should land you on a list alongside homes battling an outbreak.
When you release a COVID list of nursing homes that is inaccurate, it just drives up anxiety among those who love the people we serve and protect.
We had some questions about the list that the Florida Department of Health has released. The man who oversees this master list, the head of the Florida Department of Health, is Dr. Scott Rivkees. 8 on Your Side knows you are using this list to make life and death decisions about your loved one. After calls and emails, we're looking for answers from the top. We'd like to put in an official request to interview the state surgeon general on camera.
So again, we know that this list is very important to you. We've heard from so many of you. That's why we are trying so hard to make sure that the information on this list is accurate. And Keith, we also want to make sure that the information is easy to understand. It's a little clumsy how they're doing it right now, to be frank.
Don't know the number of cases at each facility. How widespread is this?
8 on Your Side getting results for Bay Area families. We pressed Governor Ron DeSantis to release more information about nursing homes with coronavirus outbreaks. And today, he finally did. Good evening, I'm Keith Cate.
And I'm Stacy Scheibel. Thank you for joining us. New at 6, Florida's master list of nursing homes with cases of COVID-19 has just been updated with exact numbers. 8 on Your Side has been fighting to get this information for weeks. Investigative reporter Masa Saidi now asked the governor some tough questions today. She's live in the newsroom.
And Stacey, we have been on this story, as you said, for weeks, but today was the first time that I had a chance to talk with the governor face to face, and just a few short hours later, the state released the information that families have been waiting for. Carol Davis was 80 when she died from COVID-19. Her son says the nursing home never told her about an outbreak. Same story with another family and another victim. 8 on Your Side spoke with Richard Elzerman's daughter on the phone. You went to go say goodbye to your father on April 6th. You didn't know that he had COVID, and you didn't know there was COVID in the facility.
No, I did not. I certainly would have still gone, but I would have taken extra precaution.
For weeks, we've been fighting for Bay Area families. We pressed the governor's office to name nursing homes with outbreaks and then to release detailed information about each facility, including the number of cases. Today, for the first time, we spoke with Governor Ron DeSantis face to face. You've released a list of nursing homes with positive COVID cases, but experts tell us that list is not useful if we don't know the number of cases at each facility. How widespread is this? I've talked to a lot of families. They all tell me they are not getting that information from some nursing homes.
So they're required, all those facilities are required to inform if a staff is infected. They need to inform all staff, all residents, and all families.
Here's a master list of long-term facilities with infections. You can see only one thing: the name of the facility. The number of cases and the number of deaths at each home is not included. Today, the governor told us he hadn't seen this list. It does not include the number of cases. It just has the name of the facility.
I'm happy to take a look at it. I'm happy to review it.
Would you possibly
and then
release
see what would make the most sense?
A short time after that exchange, the list was updated on the state's website. Now you can find the number of residents and staff infected at each home. So that is big progress right there, but we are still waiting to get the number of deaths at each facility. And Stacey, we're going to continue to fight until that information is released as well. We know it's important to families. As the pandemic grew, many of you turned to 8 on Your Side with a question: why are nursing home cases secret? Viewers like Holly Turner and Pam Fox say they were kept in the dark as the virus spread. In the end, both would lose a parent.
I feel what they did was wrong. Wrong for my dad and wrong for my family.
They did not give families the opportunity to make a choice, an educated choice as to whether to leave them there or bring them home.
Do you feel like you were left in the dark?
Oh, absolutely. Absolutely.
And it is important to me that someone else doesn't have to face this the way I did.
Tonight, for the first time, we can report the local nursing homes turned hotspots. On your screen, the number of facilities in each county with 10 or more positive cases, according to state data. Some outbreaks we knew about, like Seminole Pavilion, but that's not the case with other facilities, including Sarasota Point Rehab with 28 cases, 18 at Casa Mora and Manatee, and 10 infections at Savannah Court of Bartow. In other parts of the state tonight, there's 80, 90, more than 100 cases, including at 2 facilities up north.
Everyone has the right to know where the virus is.
8 on Your Side fought to get this data released. Public health experts told us the information was the key to protection.
I think it's essential to prevent the spread of the virus.
I'm thrilled that you kept at the governor to get that information. I'm thrilled that it is getting out.
Tonight, we remember Holly Turner's father. Richard Elzerman ran a wholesale nursery. He had 2 daughters, 4 grandchildren, and 6 great-grandchildren. And we are not done yet. We are still pushing the state to release the number of deaths at each facility. We know that families want that information too. That is exactly right, Keith. We fought for this list, and now we know that the Bay Area nursing homes took a huge hit. In fact, 4 of the 5 facilities with the greatest number of deaths are right here in the Tampa Bay area. These are just some of the faces of Tampa Bay families left in the dark. They struggle to get information about their loved one's nursing home, each turning to 8 on Your Side because Florida kept the human toll of this pandemic a secret. Congresswoman Kathy Castor is pushing for transparency. I just emailed the Department of Health and the governor's office. They're still not telling us the number of deaths at each nursing home. Do we have a right to know this information?
You bet we have a right to understand the full impact of coronavirus on our neighbors in skilled nursing and in nursing homes.
8 on Your Side has been pressing Governor Ron DeSantis, the Florida Department of Health, and Agency for Healthcare Administration for information. Last week, the state finally identified nursing home hotspots, telling us the number of cases at each facility. But the number of deaths was a secret until now.
You're only going to be able to tackle and contain this pandemic if we understand the full impact.
Locally, the impact has been alarming. Here's a report that details deaths. You can see Bay Area nursing homes highlighted in yellow top this list. In fact, 4 of the 5 most deadly outbreaks happened in one of our facilities.
We are actually doing an actual emergency rule.
In Sarasota today, Governor DeSantis announced a new measure to protect seniors. From now on, every single nursing home resident must be tested before they are discharged from the hospital to the home.
Even if you're not having COVID, we are now requiring a negative test to be discharged and sent back to the nursing home.
And there is a problem with this list. It is only updated weekly. For example, there's a facility in Polk County that is showing 12 deaths right now, but our Polk County reporter Stacy DeSilva confirmed today that in fact that facility has lost 18 people, not 12.
This really is a whole new chapter we've opened up here, Masa.
Yeah, Keith, it's like a never-ending saga to try and get this basic information to families and the community. When this attorney emailed me last night, I couldn't believe that it was happening again, but guess what? It's happening again. For months now, families have told 8 on Your Side nursing homes are not releasing information about infections in real time. As a result, Pam Fox says she never had a chance to save her mother, Goldie Cummings.
They did not give families the opportunity to make a choice.
Do you feel like you were left in the dark?
Oh, absolutely. Absolutely.
As an elder law attorney, we work with a lot of families.
Andrew Boyer has been following our reports as we press the state to reveal outbreaks in nursing homes. The Sarasota attorney has also been tracking the total number of infections for his clients.
It was a count since the beginning. Clearly, it was concerning.
Boyer was concerned about the rising number of elderly residents and staff members contracting coronavirus. Using the Florida Department of Health's website, Boyer recorded the total number of cases, but suddenly on Monday, that information was deleted. Tonight, Florida appears to be hiding the total number of coronavirus infections at nursing homes since the start of this pandemic. Maybe it's not adding up. Why should anyone care?
There's no such thing as too much information in this case. Without this information and knowing what the rise of infection is in a particular county or even across the state, residents can't know what their level of risk is.
And the state says that they were just streamlining information, but as I told them, deleting information is not the same as streamlining information. We hope that they're going to reconsider this and once again release the total number of COVID cases inside these nursing homes. Keith. So, Stacey, right now there's $31 million in this fund. The state is supposed to use this money to help nursing home residents. So we asked, what are you doing with this money? And they said they're exploring options. Meantime, some family members and residents and staff members are suffering.
It's hurtful. It's gut-wrenching at times. I have cried my eyes out.
David Smith's 86-year-old mom, Gisela, is in an assisted living facility. Like other families, he hasn't seen her since March. He fears she's confused, lonely, and possibly in danger. Do you know if staff members have been tested at your mother's facility?
I asked her personal nurse last night, and she told me she has not been tested. I just feel it in my bones. There has to be workers there that are carrying this virus.
We really believe that this will be a game changer.
Today, Governor Ron DeSantis unveiled a new mobile lab just for long-term care facilities. It can process 500 tests a day. But nursing home advocates like Brian Lee say one RV's not going to cut it. Lee's calling for a lasting solution, testing machines on site at each home permanently.
And if these testing machines were deployed, we could start to identify which residents are infected.
Sounds expensive, but Aid on Your Side found a way to pay for it. A nursing home pot of gold. There's more than $31.5 million and the Civil Money Penalty Fund. So how is Florida using the money? Well, before the COVID crisis began, one company got more than $143,000 to create instructional DVDs. Florida Atlantic University received $119,000 to make guides that reduce hospitalizations. And nearly $500,000 went to the University of Louisville so the school could develop a website with best practices for nursing homes. There's no question these purchases may help people in Florida nursing homes one day. But what about the need for testing machines and other supplies nursing homes could use right now? Tonight, while the state explores how to use this money, people like Smith worry about the family members it could be helping.
These are our mothers, our fathers, our sisters, that are in these facilities. They're not expendable.
So the Florida Agency for Healthcare Administration is in charge of these funds. We asked them to tell us, what have you used the money for this year? We want to make sure, Stacey, that this money is going to nursing home residents, and fast. They need it right now. You know that. I know that.
They really need it.
So I started working on this a week ago, and tonight I do have some good news to share. The most vulnerable people in our community are no longer going to be cut off from their family and friends. As COVID-19 swept through Bay Area nursing homes, Aid on Your Side uncovered more than $31 million that could help facilities save lives now. The money collected from fines and controlled by the Agency for Healthcare Administration wasn't being utilized. In an email to Aid on Your Side this Monday, AHCA told us they were, quote, exploring options. Today, there's new information on their website. Nursing homes can now get up to $3,000 for tablets and webcams. Seniors can connect with family, friends, and doctors face to face.
This is absolutely a positive step in the right direction. If it wasn't for y'all prodding them along, this would have never been added to the website.
Brian Lee's nonprofit Families for Better Care advocates for nursing home residents. He wants the state to provide continuous on-site testing for all residents and staff. Lee says that nursing home pot of gold could help reunite families for real.
Plenty of money still in the fund to go out and purchase the rapid testing machines for all of the nursing homes many times over, many times over.
I want them to be tested because I want to be able to go in there and hug my mom.
David Smith's mom, Gisela, is in an assisted living facility in Tampa. Smith called Aid on Your Side because he's concerned. He wants his mom and everyone around her to be tested.
I just feel it in my bones. There has to be workers there that are carrying this virus.
We just have a couple questions about testing at your facility. Tonight, management at the facility tells me, well, they don't have any positive COVID cases. They're also not testing all team members and residents.
If there were tests on site, families could go visit their loved ones and actually be tested and then make sure that they're safe and clear and they can go see their loved ones.
So again, it is great that nursing homes now have access to this money. They can purchase these devices for these virtual visits, but we are not done yet until people can have real life visits again. And advocates say that is not going to happen, Keith, until there is mass testing inside all of these nursing homes and assisted living facilities.
I just want to see my dad. I just want to see my father.
Families see no end in sight. Months into the coronavirus crisis, and Florida still hasn't revealed a plan to resume visitation in long-term care facilities. Advocates say the solution is simple. Put a rapid testing machine at each nursing home. After numerous emails, we had a chance to ask Governor Ron DeSantis about this proposal in person on Thursday. Governor, when are you going to open up the nursing homes again? People want to see their loved ones. You can install these rapid test machines and allow people to safely visit their loved ones.
So the question is about So what we did in the middle of March, is we restricted outside visitation.
In response to our question, the governor outlined the steps he's taken to protect seniors, including keeping positive hospital patients out of nursing homes. Then he explained why he doesn't trust rapid tests. He said the 15-minute test doesn't always identify sick patients, and that's dangerous.
You may test negative on this, you may be infected, you go in. That obviously is not good.
Next, the governor explained a different issue with the 45-minute test. He says that one says you're sick when you're not, and that's inconvenient.
You get a false positive, and then you're told to quarantine for 2 weeks when you really don't even have the virus.
8 on Your Side asked the governor's office a bottom-line question. Despite its flaws, is the 45-minute test still the best option to help our seniors reunite with families? So here's the bottom line. None of these tests are perfect. They all have errors. But the question is, does one do more good than harm for our seniors here, Keith? Well, there is a lot of information out there for consumers about nursing homes, but you have to know where to look and what to look for.
I feel like when we made the decision to send him there, we sent him to his death.
It's one of the most important decisions you'll make. Tonight, 8 on Your Side breaks down how to get the lowdown on any nursing home in just minutes. First, head to the Fed's website, Nursing Home Compare. Enter the location and name of the home to get the overall rating from 1 to 5 stars. Clicking on the facility brings you to the nursing home profile. Here, experts say the most important tab is penalties. This reveals if serious problems called for enforcement. Next, check out health inspections for complaints and staffing, another critical factor for quality and safety. Now it's time to cross-reference all this with the state's website, floridahealthfinder.gov. On the search tab, put in the facility's name. Click to get the provider profile. Advocates say immediately look for legal actions. Again, this signifies serious repeat problems. Next, scroll up to inspection details. This page will give you a summary of issues dating back years. Focus your attention on the severity and scope column. Here's a tip from the pros about what these letters mean. G, H, or I indicates the nursing home's deficiency led to actual harm. The worst thing you could see, J, K, or L. That indicates immediate jeopardy to health and safety. Finally, data about coronavirus. 8 on Your Side fought for this information to be released, and tonight you can find it on the Florida Department of Health's COVID-19 website. Scroll down to this tab for the current number of positive cases at each home. The next tab and report will tell you the number of COVID-19 deaths. And while experts say knowing a facility's history is important, we have seen facilities with a good rating experience an outbreak. We do have this step-by-step guidance posted right now on our website at WFLA.com. And the newsroom, Masa Saidi, 8 on Your Side.